Good evening, everyone, and thank you for being here. We are gathered to celebrate the first clinical experiences for the FNP 710 cohort. I'm Dr. Jan Knowles, and I am privileged to serve as the chair of the Department of Nursing. We had our first on-site day today with the students and did a little bit of orientation and housekeeping work. And then they had the opportunity to demonstrate their physical assessment skills. And the faculty have all said that this was the best prepared group we've seen in 5 years. So congratulations to you. I know that probably everyone that is currently seated served as a patient for your family member that was practicing their assessment skills. And so we thank you very much. Hope you enjoy this evening's comments. This is a very emotional time for nurses when they are blessed to go into the clinical setting and begin their new role as advanced practice nurses. We are privileged to have the president of Rocky Mountain University of Health Professions with us this evening to make a few comments. I'd like to introduce Dr. Cameron Martin. And oh, by the way, the honorees need to come in. All right. Yes. President Cameron Martin.
Thank you. I didn't want to speak to an empty house, kind of say, you're the honorees, you're why we're here. So congratulations, truly, congratulations. I hope you feel a sense of woohoo and a little bit of uh-oh, because you got some ahead of you, but celebrate the woohoo right now. Not sure that translates if you want to, transcribe that, whatever. But it is a wonderful experience, and you're here with your family and friends to celebrate this inflection point. Inflection points are important in our individual lives, organizational lives. These are the moments where we just need to stop, pause, and celebrate and appreciate what we have, where we've been, where we are, and then where we're going. And use the energy from where we've been in this moment of now to help propel you forward to some great things, really tremendous things. As I've been thinking about you today during my yard therapy, if I move a little slow, it's because after 50, gravity takes on a whole new meaning, and it's pulling me down right now. I hurt. But anyway, the shrubs look good. I should go see one, yes. Yes, they are great. But I've been thinking about you a lot. So you've already been trained. You already have this foundation. And now you're coming to us here from all over to layer on top of that foundation that you received in your nurse training, to advance what you can do. And the advancement of knowledge and experience that you're equipping yourself with will bless the lives of individuals who don't even know they need you yet. They don't even know what's happening even within their own body or what their future may hold. But because you are here on a trajectory of great training and expertise to elevate what you can do, to help anyone in that moment of need. And when your paths cross with that person, that's when the magic will happen. That's when they'll look at you and say thank you, as I have to the nurse practitioners, physician assistants, all the others, physical therapists, which I know I do need right now, who have helped me in my life. And because of the training that you're receiving and will yet receive. You'll have the skill set to do that. So trust that training. Trust that training and be present in that moment and appreciating that your paths have crossed by design for a purpose. And that purpose is for you to love and lift that person in their moment of need. Here at Rocky Mountain University, our mission is really rather simple. It's to educate and advance healthcare professionals. But our purpose behind that is really where the magic is. That is to improve the human condition, to help people in their moment of need. And the real secret is in the how we do that. We're training and helping our students. Hopefully, we're also modeling this very nature of loving and lifting. To love someone is to see them for who they are, to meet them where they are, and to listen to what they say. You'll be that clinician, that nurse practitioner who does those three magic things. I've seen medical caregivers who skip one or two of those, and it doesn't work. But when you see somebody, meet them and listen to them, then you deploy the skills that you have been gaining and entrusted with to lift them, to improve their quality of life. Wow, that's when the magic happens. That's when they'll look in your eyes and say, thank you, and call you blessed for your preparation to be there in that moment to help them. It's a magical thing. So I commend you. I celebrate you. I say thank you to you. And I say congratulations. Appreciate this moment. Celebrate it and use it as you go forward. And you'll be in situations where you think, wait, what? But stop, pause, reflect on your training, and then triage that moment, and you'll get there. Because you already are great healthcare providers. And you're going to become even better through this experience of becoming a nurse practitioner with a lot more autonomy and power and ability to love and lift people in need. Congratulations. And congratulations to your family members, all of you who are here to support them. This is a moment in time for you as well. You're celebrating such a great experience, and we'll still yet celebrate more in your future. But let's take a pause in this moment and really appreciate where you've been, where you are, and use that energy to propel you where you're going. Congratulations, and thank you.
Thank you, Dr. Martin. Often compared to the Hippocratic Oath for physicians, the Nightingale Pledge serves as an ethical guide for nurses, emphasizing a commitment to patient care, integrity, and professionalism. Despite being over a century old, the pledge remains relevant, influencing how nurses approach their roles in today's complex healthcare environment. The Nightingale Pledge was first created in 1893 by Lystra Gretter and a group of nursing instructors from the Farrand Training School for Nurses in Detroit, Michigan. The pledge was named in honor of Florence Nightingale, whose contributions during the Crimean War set the foundation for modern nursing. Originally, the pledge was intended to provide new nurses with a formal commitment to ethical standards upon entering the profession. It was a concise summary of the values that Nightingale advocated for: compassion, dedication, and respect for patient dignity. Pages are out of order. Here we go. Here we go. Sorry. The original Nightingale Pledge reads as follows: I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. The pledge reflects the values and norms of the late 19th century, emphasizing loyalty, moral purity, and the dedication to patient care. It also mirrors the limitations of the era, such as the subordinate role of the nurses to physicians and the gender-specific language which reflects the societal norms of the area. Over the years, the Nightingale Pledge has undergone various modifications to reflect the evolving nature of the nursing profession and societal changes. Modern versions of the pledge remove the religious and gender-specific language, focusing more on the universal principles of ethical practice, patient confidentiality, and professional development. I pledge to care for my patients with all the knowledge, skills, compassion that I possess, to uphold the standards of my profession, and to safeguard patient confidentiality. I will maintain my professional integrity and continue to advance my understanding of nursing through education and practice. That's an example which highlights the ongoing commitment to professional growth, patient-centered care, and ethical practice, which are core to nursing in the 21st century. Despite changes in the wording over the years, the Nightingale Pledge remains profoundly relevant in modern nursing. 5 concepts are identified in many revised pledges, demonstrating how the pledge continues to influence that profession today. Ethical foundation and patient care. The core principles of the nursing pledge, such as commitment to patient welfare, integrity, ethical practice, are timeless. In the current state of healthcare, where nurses face complex ethical dilemmas and have increased autonomy in patient care, the pledge serves as a moral compass. It reminds nurses of their duty to prioritize patient well-being above all else, fostering trust between patients and healthcare professionals. Professional identity and pride. Reciting the Nightingale Pledge is a rite of passage for nursing students. It symbolizes their entry into a respected and noble profession. Enabling them with a sense of pride and responsibility. This tradition serves to unify nurses across generations, fostering a strong professional identity. Advocacy and patient rights. The pledge's emphasis on patient confidentiality and welfare aligns with modern nurses' focus on patient advocacy. Nurses today are not just caregivers. They're advocates who ensure the patient rights are respected and their voices are heard. The Nightingale Pledge underlines the nurse's role in safeguarding patient dignity, autonomy, and privacy, which are critical elements in the contemporary health field. Commitment to lifelong learning. The Nightingale Pledge states, to maintain and elevate the standard of my profession. And this statement resonates with modern nurses, with the emphasis on continued professional education. Nursing is constantly evolving with new research, technologies, and practices. To provide the best possible care, nurses must commit to lifelong learning, staying updated on the latest developments. Interdisciplinary collaboration. The original pledge included a commitment to aid the physician in their work, reflecting the hierarchical structure of healthcare at the time. In modern healthcare, interdisciplinary collaboration is necessary in order to provide holistic care. Nurses work alongside physicians, physical therapists, mental health professionals, social workers, and other healthcare staff to create comprehensive care plans that address all aspects of a patient's well-being. The Nightingale Pledge emphasis on collaboration and loyalty to the healthcare team underscores the importance of this teamwork in achieving positive patient outcomes. When we consider these 5 concepts, we find the 7 core values of Rocky Mountain University. The first, evidence-based. We fuse our experience with the best possible evidence to achieve the best possible outcomes. Learning-centered. By challenging thinking, encouraging growth, and exploring possibilities within a supportive learning environment, we empower learners to rise to their highest potential. Authentic. We recognize our imperfections, and we welcome growth stemming from both success and failure. We believe in our unlimited capacity to find solutions. We model gratitude. We seek to understand, to empathize, and to forgive. We are service-oriented. Because we value people above all else, we serve each other, our patients, our clients, our communities, and the world. Trustworthy. We strive for honest, respect, and accountability in all we do to continuously earn credibility as an institution and as individuals. We are inclusive. By honoring our differences and similarities, we strengthen institutional and community connections. We are collaborative. We learn and create within and across teams to innovate, foster change, implement strategies, ensure accountability, and celebrate achievement. The mission of the Department of Nursing is to provide a student-centered education that prepares graduates for socially responsible, outcomes-oriented, evidence-based, autonomous, and collaborative practice. The vision of the Department of Nursing is to prepare graduate-level nurses to advance the quality, delivery, and efficacy of healthcare. As you accept these white coats, students, we invite you to stand next to us as nurse practitioners, providing compassionate, evidence-based care to individuals, communities, and populations in our ever-changing healthcare environment and world. Congratulations, go forth and change a life. We're going to have Dr. Ballard call the names, and then the director of the FNP program, Dr. Megan O'Neill, and I will place the coats on the students.
Melanie Baca. Madison Bell. Shauna DeMille. Layson Frady dos Santos. Amber Rose Gale. McCall Hurt. Lisa Marie James. Jeff Kirkham. Wendy McGee. Brinley McKay. Zachary Miller. Catherine Morgan. Haley Muhlenberg. Sabrina Wynn. Alyssa Nyberg. Mackenzie O'Connor. Lacey Rivera. Tamara Thiessen. Abigail Smith. McKenna Smith. Sierra Williams. Carissa Yee. Robert Young.
Congratulations again. We would invite you to take pictures with your family in front of the Rocky Mountain logo here. You guys just take your turn coming up, and we would also invite you to enjoy some refreshments at the back of the room. We have coffee and water and some light snacks. We appreciate very much you being here, and we look forward to seeing you 3 semesters from now at graduation. We thank you so much for coming.